Ladies and gentlemen, welcome back to Coach's Corner. I'm your host, Jeffrey Hartford. And for those of you that are new here, COACH is an acronym that stands for the Conduit of Optimism, Altruism, Consciousness, and Health. And it's with those topics that I try to bring on a guest that can bring us some information and add to those levels of our optimism, or our altruism, consciousness, and health. And with that, today's guest is my friend and acupuncturist, Elisa Hirsch-Cotter. In addition to being an acupuncturist, she's also an herbalist. And we'll find out in just a moment. I know she's also a trained yoga instructor. I do not know if she still does that, but pretty interesting to me. So we'll throw it over to Elisa. Elisa, tell us a little bit about yourself, and we're going to dive deep today into some acupuncture.
Well, thank you so much for having me. This is so exciting to be talking to you and sharing what I love and what I do. So I grew up here in the Hudson Valley. Fun fact, my kids go to the elementary school I went to growing up. So I have always been interested in the body and natural remedies. I grew up with my mom giving me tinctures and bringing me to the homeopath, seeing a chiropractor. And I actually got into acupuncture because of my mom. She has struggles with chronic illnesses and migraines, and really tried lots of different things to help herself, both from a Western perspective and then other things, as I mentioned before. And she started to see an acupuncturist when I was a senior in college. I went to SUNY New Paltz. I was about to graduate with a bachelor's in psych and thought, oh my God, what am I doing? What am I going to do next? While my primary interest has always been mental and emotional well-being, I was like, I'm not sure what I'm going to do. So my mom at the time started seeing an acupuncturist, and she kept telling me how much she loved it and she was feeling better and she thought that I would really like it. So naturally I was like, well, I want to go see her. What is this? And really, I fell in love. It was the first time I felt like someone really listened to me. She took her time. She asked me not only about the things I went in for, but about all my body systems, how I was sleeping, what my digestion was like, what my menstrual cycle was like, my lifestyle, what my activity level was like, what my stress level was like, what my diet was like. And I really felt like working with her was one of the first times that I just felt better overall. And it wasn't these drastic changes right away, right? I don't believe that's how change really happens. That's not how healing really happens. But I felt incrementally better. I actually am in the offices that the acupuncturist I went to was here, and I'm here now, which is so great. Thinking about, I've been in practice 14 years now, so that was, I don't know, probably almost 20 years ago. So I finished at SUNY New Paltz, took a semester off, and then I did my graduate work in Manhattan at Pacific College of Oriental Medicine, where it was almost a 4-year program. You could either just study acupuncture and Chinese medicine, or you can also do herbology. And I fell in love with herbs. Just like growing up taking tinctures, it was like, ooh, it's a beautiful relationship between how herbs relate to one another, how they balance each other, just like our bodies. We're multidimensional. We're multidimensional. We're not one thing. And so, yeah, and here I am 14 years later.
That's beautiful. I love that dynamic of, being exposed to it early on and instantly being interested in doing it. It's rather interesting. I too would say that I've gotten pushed into the healthcare industry through my influence with predominantly mom, but I'd say mom and dad as well, family. But
Yeah.
for a little bit of a different reason, my family was very much in the program of allopathic medicine. You go to the doctor prescribes you something, you take it, you take all of it, you do
Right.
as you're told. And, growing up, we had a medicine cabinet. And it's just looking back on it, Listen, I'll say allopathic medicine plays a role. I think there's a time
Yeah.
and a place for pharmaceuticals, but we clearly overprescribe pharmaceuticals, and we don't use nearly enough of things like nature and movement and rest and the things that are considered alternative medicines, like massage as I do, the acupuncture as you do. And there's just so many things that we can do to give the body the proper stimulus to heal itself, as opposed to pretending that whatever ailment we have is due to some deficiency of a drug,
Hmm.
right? It's clearly not it. And I've talked about this before, but sadly, following that protocol, we see this over and over. It doesn't work very well when we just rely upon that system.
Right.
My dad just passed away back in March of this year at only 69, and mom passed away January of 22 at only 65.
Yeah.
And it's one of those things that I certainly don't blame the system. There were things that they could have learned on their own, but I bring that up to say that it's interesting that we both got pushed down similar paths, but for rather different reasons,
Yeah.
right?
Definitely. I mean, and you touch on something that I often talk about in my practice is that what I do, I'm not doing anything to someone's body, right? The whole idea of Chinese medicine is helping the body heal itself.
Hmm.
From what I do, it's really an energetic standpoint. I'm figuring out by asking you lots of questions and observing you what maybe is imbalance. And really, what my goal, and just like you, is just really facilitation, right? The
Hmm.
optimal environment that healing can take place. And that's different for everyone that comes in. I could have two women come in with irregular menstrual cycles and they're caused by different things. And really, that to me, that's the beauty of what I do.
Hmm.
It's never one size fits all. I love learning about how someone's going to respond to a treatment and how someone may respond. It may take a few times so that to see what we want to see, that to see that things are starting to work, that how they need to, the way they need to. So it's just so fascinating.
Absolutely. Yeah. And we'll definitely dig into that a little bit deeper, because I do want to get into, letting the audience know, if they haven't had acupuncture yet, what they can expect, and
Mhm.
how that'll go. But I will say, having had acupuncture before I came to see you as well, which was also a wonderful experience. In fact, I had her on the podcast previously as well. I'll say your intake was a bit different, and I did appreciate it. It was very, very thorough. And I love the more of that true traditional Chinese approach to it, that I remember learning in massage school in our Eastern class about, looking at the eyes, looking at the tongue, and
Mhm.
really digging deep into understanding what the body is telling us, and not looking past that like we clearly do in Western medicine, allopathic medicine, that, there's we're lucky if a doctor spends 5 minutes with us to find out,
Yeah.
okay, what are your symptoms? Okay, those symptoms tell me I can diagnose it as this, and here's a pill, here's an injection, and oh, let's schedule your surgery.
Yeah.
So I really do appreciate that. And I can relate, even with my approach to massage as sports massage. It's each person that comes in, it might be a stiff neck, it might be a stiff lower back, it might be an elbow or a shoulder bothering them, but for significantly different reasons. And as a result, the approach is going to be quite a bit different.
Yeah.
Um, and it makes me recall back to it was long overdue that I finally got in to see you. I had been meaning to do it for quite some time, but the journey that I'm on personally now, of getting my diagnosis of my tumor and recognizing instantly, I just felt it viscerally, that I'm going to be okay and my body is going to heal itself. And I know that, but I want to be sure to give it every possible
Mhm.
opportunity I can. And I really knew that acupuncture would be an avenue for that. So I guess that'll be our door to open up into giving people an understanding of, when we're talking about acupuncture, and it's these tiny, tiny little needles, and
Yeah.
the meridians, and trying to get any stagnant energy and chi. So that's kind of me just throwing some of the words out there that I am aware of, but I'll paint that picture and let you take over, but give people a good overview of what it is that you do.
Yeah. So Chinese medicine, traditional Chinese medicine, and I kind of want to go back to something you said about like how my intake is more of the traditional intake. There, I do think that like many other things, sometimes acupuncture is becoming westernized, where it's
Mhm.
just becoming a physical thing. And that's fine. That's how some people, practitioners choose to treat someone. I really am about like traditional Chinese medicine, 5 element theory, figuring out what's going on systemically. I don't want to just treat what we would call like a branch of the root. But sometimes that takes a while to figure out, right?
Yeah.
So, Chinese medicine is based on a system of meridians, like you were talking about. Meridians are like roadways in the body through which
Mhm.
our resources flow. We think about mainly our energy, what we call is qi. There's also blood. There are resources that need to be in balance, such as yin and yang. So when someone comes in, I am observing them. I'm asking them all of what's going on in their body systems, like we mentioned before. I look at their tongue. So when I look at someone's tongue, I'm looking at what the shape is, what the color is. Is it moist? Is it dry? Is it pale? Is it red? Are there peeled patches? And then I take a person's pulse. So we have 3 pulse positions on each side of our wrist. And each pulse position corresponds with a different set of meridians, or these roadways through which all of our resources flow.
Mhm.
So when I feel your pulses, some people say to me, like, am I still alive? Because I linger. I'm overall feeling what's going on. Are they full? Are they thin? When I press on them, do they go away? When I press on them, do they bounce back at me? Is it really fast? Is it really slow? So through all of this, I am figuring out where there may be that imbalance. Like you said, the stagnation. Stagnation is basically lack of flow. Very often we have concurrent stagnation and deficiency, because if our resources are stuck here, it's not, some of the other areas of the body and the channels are not being nourished. So it's a
Mhm.
delicate balance of restoring flow, nourishing, and again, it depends on the person. For instance, I really focus a lot on women's health, with
Mhm.
women trying to conceive, during pregnancies, postpartum, irregular cycles, perimenopause, menopause, postmenopause. And at certain parts of a woman's cycle, I may not want to move a lot because that's not going to be beneficial. Whereas
Mhm.
other parts, I do want to encourage movement in the body. And it depends on the woman. What is their flow like? And so much more.
That's wonderful. And yeah, it goes back to what you mentioned earlier that it's different for everybody, and that's really why that intake is so important. And you're right. I love that approach, that it is more of the traditional approach as opposed to trying to westernize it. And I do understand from a business perspective the movement towards westernizing it, because
Totally.
in our society, people are so quick and they just want to come in and, they expect, you touched upon this earlier, that they expect this sense of, okay, I'm better now. It was one visit, I feel better. But it's really about guiding the body towards healing
Hmm.
itself. So it might not be a quick fix type of thing. It might be something that, in conjunction with some other protocols, be it the herbal
Definitely.
approach, or hydration, sleep, all these different things that we can take into consideration. And really, that's what these discussions are all about, is trying to give the listener more of this information to empower them to know
Hmm.
what it is that they need. And not, I often catch myself saying this, but I don't think I can overstate it, that I really see us moving from what I've called the disempowerment paradigm, and we're ushering into the empowerment paradigm. And
Yeah.
that big distinction is, in disempowerment, it's using this element of, I'd say, some fear, and making somebody feel like on their own they can't do it and they need the practitioner, the professional. There's
Right.
different approaches out there that, I'll say it this way, and this is not a knock on the profession, but oftentimes the approach that they do, chiropractors will leave people feeling like, well, you need to see me 3 days a week
Hmm.
for perpetuity.
Hmm.
And there's no additional things added to it. Now, again, I know some phenomenal chiropractors. That is not a blanket statement,
100%.
right?
Hmm.
But
Yeah.
stereotypically, I have that conversation with a lot of my clients. So that's what's fresh in my mind. And to me, that approach is that disempowerment approach.
Yeah.
Whereas to empower somebody is to let them know. I tell my clients all the time, I say, listen, I'm not the best businessman in the world. My goal is to see you as few times as possible for
Yeah.
you to feel the way you want to feel and know how to stay that way.
Mm-hmm.
And that's empowering. That's what we're looking to do. And I felt that in your office. I did write down a couple of notes just to make sure I went down the path I wanted to. But I say for you personally, as well as in your office, the energy is just that of comfort and healing. And I
Mm-hmm.
felt like I belonged. I never once felt rushed. Your first appointment being a full 90 minutes, I find to be absolutely brilliant.
Yeah.
Nothing about it felt rushed. I felt so, really calm and peaceful. And, I felt like I was in phenomenal hands, and that intake was great. And I will say too that that table with the warming pad on it was quite comfortable.
It is. It's like encapsulate you too. You know,
Yes.
I think I love acupuncture. I love Chinese medicine, but I really think at the core of what I do as a provider in my practice is hold space with someone.
Mm-hmm.
And for me, one of the primary things I wanted to do was create a safe healing space. I've had people say to me, "Will you stay in the room so I can talk to you the whole time, or can I pay you and we can just talk?" And I was like, "No, no, 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 no." But it really is that heart to heart connection.
Yes.
One of my mentors does. I think it's called wholeheartedness or whole heart connection. And it's about like meeting someone here, connecting, right?
Mm-hmm.
Just being, holding, being, nothing else is happening. Because that's when we really know, that's when we really see each other. That's how you feel. Part of, I think you could probably agree too, what we do is intuitive.
Yes.
I think that we can have protocols and take our classes and learn pattern diagnoses, in terms of Chinese medicine and learn techniques,
Mm-hmm.
but that changes over time. After 14 years of doing this, sometimes maybe when I'm treating someone and I have an idea and then I'm palpating, I'm touching, I'm feeling, I change what I'm doing. I
Mm-hmm.
modify what I'm doing because I feel like there's a shift.
For sure. I love that. And actually, it's interesting that my mind went here when you said that. But if you're familiar with Gary Vaynerchuk, uber successful businessman, and he often talks about what makes him as successful as he is. He tells people all the time, I can't teach it to you. This is what I do. This is my gift.
Yeah.
It's pattern recognition for him. But I
Mhm.
think there's an element of that for us too, that you're right. There is definitively an intuitive sense. And, there's a common theme of healed people heal people. And I think oftentimes those of us that have healed ourselves or gotten healed become the quote unquote healers. But
Mhm.
even that phrase, I don't like the phrase of being called a healer, because as you alluded to, it isn't that I'm necessarily doing this thing. It's simply holding space and giving the body the stimulus it needs to heal itself.
Right.
But within that, you're right. I mean, I think back to being in massage school, and I was there with some wonderful people, but many of them even said while we were there, they didn't intend on being a massage therapist, and or as it was clicking for me, they were kind of baffled that, how are you getting this? I don't understand it. And maybe the time was right for me. I came in with a background of being a personal trainer. So it was kind of just finding my niche, and it worked for me. But yeah, I'm absolutely with you there. And it's finding that, finding our lane, I guess is the way I
Yeah.
put it. Right.
Yeah. And going back, you were mentioning too about, you know, healing and recommending lots of different things. I also, as a provider, I refer out,
Mm-hmm.
or I can often say, I'm not sure if we're the right fit, but here is an acupuncturist I think would be better suited for you. I probably not the best business person, but yes, I need to provide for myself and my family, but also I am really in it to help people. I think that's what life is about. We need to pay bills and all this other stuff, but if we are authentic, we will be okay. And our job, if it were not the person who is that conduit for this person, is to be like, you know what? I know this great person. Try her or try him. I think you'll be better suited.
Absolutely right. I've this isn't the quite the right word for it, but I'm going to say it this way anyway because it's what came to mind. I'm guilty of that too. You know,
Mhm.
again, it's in the best positive sense of being guilty of something, but
Right.
there's a time and a place that yes, I'm not the right one for you, and that's okay. And I don't take that personally. I'm not going to lose sleep over it. I would much rather recognize that and refer out, and that's the
Mhm.
beauty of the networking as well. I mean, I know
Definitely.
plenty of other local massage therapists that are fantastic
Yeah.
that we have a different approach. With
Hmm.
my background in personal training, my approach to massage is very much a sports massage and
Hmm.
influenced a lot by Eric Dalton and myoskeletal alignment technique. That just, it really made sense to
Yeah.
me. But yeah, it really is, it goes back to it. And I could say it all day, but it's about giving the body the stimulus it needs to repair itself and being there for people and
Yeah.
hopefully providing them with the awareness of when they may need a professional
Hmm.
hand and what to be doing on their own
Yeah.
otherwise,
Yeah.
right? So I did write down that I know there's a couple of other techniques that you offer within. So acupuncture is your primary thing. You're also an
Mhm.
herbalist, but within your acupuncture treatment, again, based on what the individual's needs are, you also offer cupping, which I had done and was fantastic, by the way. And then I wrote a few down: the Gua Sha, the
Yeah.
Moxa, Tuina, and the auricular acupuncture. So if we can go through each of those and just give
Yeah.
people an understanding of what they are. And I won't
Mhm.
lie, the Moxa was something that I was like, wait a minute, what's that? So we'll spend a little bit of extra time on that. I'm very curious about.
Yeah. So a lot of people who are listening probably know what cupping is at this point, right? I
Mhm.
think Michael Phelps
Yep.
definitely made it very popular. A lot of athletes are getting it done. So 14 years ago when I started practicing, only acupuncturists were really cupping.
Mhm.
Now a lot of physical therapists and massage therapists have incorporated it into their practice. The idea of cupping is basically to break up those stagnations we talked about before.
Yep.
From a plainly physical standpoint, when you have a knot, right?
Mhm.
What you can do, and one of the most common areas is on the back. You can create a suction and you keep the cup stationary, or you can slide it. There are different types of cupping. More recent, there are plastic cups where there's a pump.
Mhm.
Um, I primarily use traditional fire cupping. So I have a glass cup. I soak a cotton ball in alcohol, light it on fire, sweep it through, put it on. It looks really cool and
Mhm.
scary, but it doesn't hurt. The cup isn't hot.
No, it
You know,
feels fantastic.
that way I'm a little more in control. I mean, I think the plastic ones are fine,
Mhm.
but I think glass cupping is superior.
Nice.
And so some people come in and they say, I had cupping, but I didn't have this mark. Why didn't I have this mark? And I say, because all of our bodies are really different. I could do the same suction on three different people, and everyone's going to have a different mark.
Sure.
Someone may have nothing, someone may have pinkish red, and someone may have purple.
Yep.
So, really, what that shows me is the level of stagnation or blockage, right?
Mhm.
The level of tension in the body. That can be physical, it can be energetic, it could be years of physical, emotional. So, a lot of the time, I use it for people, especially this time of year, who get sick and have a lingering cough or a cough that won't break
Mm.
up. So I am a big fan of cupping.
Yeah.
I love to get it done. I think it's really great. I don't do cupping on everyone.
Mhm.
If someone tends to be more weak or fragile or older
Yep.
or really young, that being said, I have done cupping on my kids. I don't really do it, or I try to make it as a light suction. If someone's
Yep.
on blood thinners, I don't do it because they're more risk for bruising and bleeding.
For sure.
So, using it at people's discretions, like really figuring out, is it appropriate? And sometimes people come in and they have the cup marks from their massage therapist or physical therapist. And I say, I'm not going to do cupping today because you have an active mark there.
Yep.
So that's an injury, right? I want that to heal. And then next time we can do it. Gua Sha is another good thing to do, a really effective treatment. A lot of people will, can buy those Gua Sha for their faces, these facial Gua Shas, which are great. That's not the kind of Gua Sha I necessarily do.
Mm-hmm.
It looks almost, I should have brought it in. I have it in the other room, but the type that I use is a jade kind of square looking device. I sometimes tell people it's like scraping. So I can gently or more vigorously kind of go over the area. And it almost creates these like micro injuries and microcirculation. So very similar concept as cupping in terms of increasing blood flow, breaking up areas of stagnation. Feels really great. Not everyone likes it, but most people who I do it on are like, oh my God, can you do more? Moxa, super, super, super effective. There are different forms of moxa. It's an herb that can be burned. It comes in many different forms. You can have loose moxa. You can have stick-on little cone moxas. I have moxa bowls. It has an odor to it. It smells a little like burning leaves, or some people believe it smells like marijuana. It's not. I always tell people that. I use it primarily when I feel a condition is cold in nature. So in Chinese medicine, a condition, imbalance, illness can be more cold. For instance, it's better with heat. Someone's tongue is really pale. It gets worse in the cold weather. Also for deficiency, whereas cupping is more used for an excess condition. Sometimes I use simultaneously. So I'm warming an area. I use it a lot for women trying to get pregnant, different gynecological issues, painful cycles, heavy clotted cycles too. And also we use it to help create an environment so a breech baby can turn to being in the correct position. Which is great. I have a really great referral and network. So some midwives and OBs actually send their patients over to try. For some women, it's super successful. There's always some cases where it doesn't work, but we did quite a few women who needed a little assistance. Tuina is like a massage. It's a Chinese massage. There are some practitioners who really dive deep into it. I'm not one of those, but I am trained in it and I do use it sometimes.
Nice.
Yeah.
Nice. And then what's the distinction? I know it's in the ear, but the auricular acupuncture versus the rest of it. What's the distinction there?
So our ear is a microsystem of the body. It's thought to be an inverted fetus. So sometimes if someone is really sensitive, or I want to minimize the amount of needles I have, or if I only have a short time period, I try to utilize the ear. There's a whole protocol. It's called the NADA protocol that's used a lot for addictions, for PTSD. So it's a way to enhance the session.
That's fantastic. Now, that makes me think, the way you describe that makes me think of like reflexology too. Is there a map of sorts of the ear for that's fantastic.
Yeah, that's really great. That's total. It's a good comparison. Very much so.
Great. Excellent. I'm intrigued by that. We might have to do that sometime. So it's interesting too. You mentioned how some people respond really well to those treatments and others maybe not as much. And that makes me think about, I know that I run into that sometimes as well. And this goes back to the conversation too about maybe somebody not being a fit, but I often think about it from a perspective of our placebo nocebo. If somebody's coming in and they're very open-minded, they already believe it's going to work. Listen, I personally, I've heard that as a knock for massage therapy before, that, it's just placebo. So that's fantastic. It's not a pill. It's not an injection. It's no surgery. There's no harm coming from it. And somebody feels substantially better afterwards. to me, that's a wonderful thing. And if you call it just placebo, then I'm still grateful for what I do. And it
Mhm.
makes it even more applicable for the way that I do it, that I'm not trying to tell somebody they need to be in with me 3 days a week,
Right.
It's
Yeah.
see me as needed, and hopefully you feel better and you don't need me. And that's a wonderful thing,
Yeah.
So with that in mind, do you find that plays a massive role with the acupuncture as well? If you notice somebody comes in and they might be a little more reserved, a little more apprehensive about it, do you find that impacts the treatment?
I think sometimes
Mm,
I often feel like if someone is like this when they're come into the office, they have difficulty relaxing.
mm,
And I think we have talked about this in even I could have mentioned it before. Acupuncturists have different styles, right? Some use trigger point work and a heavy needle technique. That's great.
mm,
I don't necessarily practice that way. There's no one is better than the other. One of the reasons I don't is I think that healing takes place when our sympathetic nervous systems are at rest, right?
yes.
And so that is one of the primary things I want to do when someone's here. So if someone's like this the whole time and they're worried, and that's not uncommon,
Yeah.
it, I think they don't necessarily have as much benefits just because it becomes a stress response. So I often say to someone, if they're in that state, please give it 2 to 3 times. And
Mm,
so that you figure out and your body figures out if you can trust me, if you can trust this process before we say, is this working or not?
yeah.
I I don't ever tell people to come in 3 times a week. Like
Yeah.
I'm not that kind of provider either. That's fine if other people do that. And so when I say that, it's not a like a ploy to come in to stay with me. I'm really honest, and I say if after 3 sessions, if it's not making a difference, let's move forward. Let me refer you to someone else.
Sure. Yeah, that makes me think too. I recall back to prior to becoming a massage therapist myself, getting my license and all that, having been on the receiving end of a massage and on the table, especially being a man and having, at that time, there were a couple of female practitioners I had, and I don't know if it was just their approach or what it was, but there were some techniques they did that it was causing discomfort, and
Mm-hmm.
I did not feel comfortable speaking up. And then I learned in massage school, there's a term for that. It's the power differential. And I remember that it triggered something in me. I said, that's what I was experiencing. And I don't ever want somebody on my table to feel what I felt. So I
Mm-hmm.
actually have that conversation almost with everybody that comes in. But to your point, that the person that's more like this, a little more reserved, a little more guarded, I
Yeah.
let them know that from the get-go, because
Right.
you're absolutely right. That's exactly how I explain it too, is my goal is to help turn off the sympathetic, turn on the parasympathetic. That's where healing takes place. And if you're sitting here nervous and tense and guarded, it's the complete opposite. That's the antithesis of what we're trying to do.
Right.
So when I paint that clear picture of this is what the power differential is, and this is why I want to keep some dialogue going. I
Yeah.
want to bring my body lower down. I don't want to hover over the table really high and make them feel tense. So
Yeah.
I'm 100% with you there, and
Yeah.
it's
And it made me think about I say, especially when a patient first comes in, please let me know if something is uncomfortable.
yeah,
It's okay to feel something. I don't want you to feel like you have to be quiet or suck it up and this is part of the healing process. Please talk to me about this because everyone is different and I would never want anyone to feel that way. I have had different types of therapy where I should have said something and I thought, well, maybe this is part of the process. And I don't want anyone to ever feel that way.
amen. That goes right back to it. I think that we have so much in common. I think that's why my energy is so calm around yours as well. Same thing. It's like I alluded to before. I view the two of us as
Yeah.
healed people who have been through something uncomfortable before and can now pull from that experience and share it with the people in with us. And I think it serves us as well as them. And that's really helpful in that capacity. I
Yeah.
had something else in my mind a moment ago, but I'll come back to it. What I'm thinking, what I want to try to do is if we can take the people through kind of an expectation of what is that first appointment like,
Mhm.
or better yet, backtrack even more, what do they expect beforehand? Like you send that phenomenal email with all the forms to fill out, very thorough. I highly recommend for any of you that haven't yet and you plan on getting in with Elisa, do it. And don't be overwhelmed by the intake. Spend your time with it because it makes the treatment that much better. But kind of a not start to finish, because who knows what finish looks like for people, but kind of that process of when they get started, they want to schedule that appointment and how they go through, kind of paint that picture of what they can expect.
Yeah. I always joke I'm a one woman show. So if whomever is interested in coming in for acupuncture, I have them contact me personally. I don't have any online scheduling. Um, yeah. So, I mean, like you said, sometimes people will say, first time they come in, they're like, I feel like you know more about me than anyone else knows.
Yep.
But it's important for me. Sometimes people leave out information, that's okay. But I really encourage people to be open and honest. And so, like you had mentioned before, this session is 90 minutes. There's no one else here when I am seeing a new patient. I go over the intake that, for instance, when you came in, that you filled out. I ask you additional questions. We elaborate. Sometimes someone may say, remember that how you asked me about that thing, like my poop, and I didn't realize it, but yeah, you're right about that thing.
Yeah.
And part of it, what we do is self-awareness, right? And like you said, empowering someone to be aware. Most of us are like out here, ready to jump off the chair, ready to jump off the table.
Yeah.
So yeah, I go through the intake. A lot of information can be divulged. Sometimes people don't talk. They don't want to talk.
Interesting.
Okay. And sometimes most people do talk to me. I think it's partly who I am. And so then I look at your tongue and I take your pulse and then we do a treatment. Sometimes people say, well, I didn't know what to wear. And they say, you can wear whatever you want to wear. Everyone is very different. That's another thing. I never make people take off their clothes if they don't want to.
Mm-hmm.
I have patients who don't want to take off their socks. And I say, well, there are a lot of points in the hands and the feet that really are strong and can create change in someone's energy. But if you don't want to, we don't do it. And there are other people that are like, yeah, no problem. And so I have towels and I create drapes. Sometimes I'll have someone lay face up and then face down, or vice versa. Or if I feel like someone is on the deficient side, I don't do multiple positions. I do minimal needling. And then we come up with a treatment plan. I don't always talk about herbs the first session. Sometimes I do, but it's part of me figuring out how your body responds to the session.
Sure.
And then in the follow-up, I usually tell people to come within a week or two, but it depends what's going on. Is it acute? Is it chronic? If it's a woman trying to get pregnant, if it's a woman who, or I should say a person who is using a reproductive endocrinologist, depending on where they are at a certain point, or if they need labor preparation and they're trying to have a natural vaginal birth. So it depends. We also talk about financially what someone may be able to do.
Sure. Yeah, that brings up a great point too. I know for me, and I'm rather certain this is true with you as well, as an out-of-network provider, they pay out of pocket. And I know there is a scenario with massage that they can do this, though I haven't had anybody follow up with it yet, that they can get reimbursed through their insurance. Is that how it is? Because you are cash-based, but
I
can they get
am.
reimbursed? Okay.
Yeah, I am self-pay. And so part of why I switched over to the forms where I can then send you to your email addresses, I can provide super bills really easily. So I have plenty of patients who I provide a receipt or a super bill and they get reimbursed. I do make it clear that I will provide the super bill, but I don't talk to insurance companies.
Yep.
So if they need me to redo it, I do it. But yeah, usually there's a percentage that gets paid. I have a lot of people who use their HSA accounts too.
Yep.
That's
Same.
very common.
Absolutely. Yeah, same. All right. I mean, we've touched upon quite a bit here. Oh, we didn't go over. Are you still doing yoga?
So I'm not a yoga teacher. I used to practice a lot
Oh,
of
okay.
yoga.
Okay.
I grew up as a dancer. I went locally. I wanted to be a professional dancer. And then I got really into yoga. I practiced it a lot. I went to California and did something called tri yoga. And just, I think that it is one of the ways and the first times I learned about meridians,
Hmm.
even before I started to go to school for acupuncture. Actually, there was I don't know what the name of this place was. It was in Fishkill, and it was yoga, but it was like stretching, and it was based on meridian theory. And
Mm.
it was so powerful and so incredible. So I think that was kind of like my first taste. I remember then starting acupuncture school and being like, oh my God, that yoga was based on the Chinese meridian theory. So,
That's fantastic.
yeah.
Oh, I like that a lot. Yeah, yoga is one of those things that I think we can all benefit from, but so few people truly understand what it is. When I hear
Mhm.
doctors telling their patients, "Oh, you need to stretch more. You should do yoga," I said, "It isn't just stretching. There's so much more to it."
I agree. And I do think, just like other things, you have to go to the right practitioner, the right teacher. It can be very powerful. And I have seen people get injured
Yeah, for sure. For
for
sure.
not having proper form.
Oh, absolutely. I mean, there's so many of us that are just so restricted, so dehydrated, but especially if it's in a class setting and trying to just emulate what everyone else is doing, looking around, oh, if they can do it, I can do it. Let me try
Right.
harder.
Hmm.
No, again, sympathetic, parasympathetic. Be able to relax into it if you're really feeling that stuck. We don't force into that, you
Right.
know? Yeah,
Hmm.
and it's certainly not what the whole setup of yoga is really about.
No, no.
Um, so I will say I'd love us to get, if you want to, get a little more into the herb side of things, and if there are some, top ones that you do recommend, what you recommend them for, and however in depth you want to get with that. I'm certainly
Yeah.
curious.
The way that I practice herbs is I really keep it in the scope of my practice. So I use Chinese herbs.
Mhm.
There may be supplements that I recommend in my practice based on my own research and taking classes, but I use traditional formulas either in pill form or a granule form, like a tea form. You add water. Sometimes I do custom formulas, sometimes vacuum packed tea. So I wouldn't, the way that I practice, I can't say, I think these are the top formulas that most people should use.
Yeah.
Because again, it goes back to you as a person. If you have, say, you're struggling with fatigue,
Hmm.
you and Bob have fatigue. There are probably two different reasons for that. So I can't say you should try this formula, without seeing a person. Very often people say, you gave me that formula. Can I give it to my friend because they're having this issue? And I always say, well, it's not necessarily the correct formula.
Yes.
Um, for kids, it's a little bit different. I do herbs with kids. They're more tincture forms. Like my kids have been taking herbs since, I don't know, they were 2 maybe. They're used to taking them. They're bitter. They don't taste
Mhm.
great to kids.
Yeah.
But sometimes I do have some pediatric cases. It's not my primary practice. It's not my caseload. But I help some of my patients with their kids, and I'm always like, well, it's gonna taste bad. Do you think they're gonna take it? But I feel like kids respond so well to herbs and acupuncture. Their systems are more pure too. Their
Yes.
things are changing easily and freely. And so I think a lot, not all, I do think a lot of antibiotics could be avoided if
Mhm.
we look into other options and right away. I know it's helped my kids. Again, I'm not saying there's anything wrong with antibiotics. I just feel like they're overprescribed and create gut issues and microbiome issues and leads to all these other different things.
Yeah,
Um,
couldn't agree more.
yeah. So, like, our medicine cabinet at home is filled with vitamin and herbs.
I love it.
And sometimes my kids will say, "Oh, my nose is stuffy. Can I have some nose herbs? I need my nose herbs." And
That's
even my
great.
husband's like, "Do you have ear herbs? Her ear hurts her." So
That's
I have
awesome.
converted my entire family.
I love that. Well, we'll definitely have to dive a little deeper into that when I come for my next appointment, see what it is that could serve me, and
Oh,
I'll
I
pick
have
your
some
brain a little bit
ideas.
more. I'm sure of it. I love it. I look forward to it. That's
Yeah.
awesome. Well, do you have a social media presence that we can send people to?
Yes, I have an Instagram that I'm not so active on, but you can find me at EHC Acupuncture. I
Okay.
have a website. It's my name, no hyphen. But yeah, I have a Facebook page too.
Very
If
cool.
I don't respond to a Instagram message, it's just because I don't have alerts, but I
Mm-hmm.
will look at it. I think that we live in a society where we're just like ding 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 ding. There's so much going on, so I try to limit it. Just like Facebook, it's on my laptop when I come to work.
Yep.
So
Good for you.
best way to reach me is either calling me or texting me or emailing me.
Fantastic. Yeah, it's funny. I use my phone in the office for my music. And
Hmm.
because of that, I can't be interrupted while I'm in the middle of an
Right?
appointment with the music playing. So I started Do Not Disturb on my phone because of that. And I realized, you know what? I like this.
Oh,
Right?
so good. So
My phone is always on Do Not Disturb. I tell
yeah.
people all the time, you can certainly call. I don't know when I'm with an appointment, so I'm likely
Right.
not going to get it. But if you leave a voicemail, I will call you back.
Mhm.
If you leave a text message, I'll get it. I'll call it back. And same thing with be it Instagram, anywhere. I'll
I
get to it
agree.
eventually. And the moment I get to it, you will hear back from me. But it isn't a constant, oh, my phone, oh, my phone.
Right.
It's the most
I
peaceful
agree.
thing being disconnected from that thing.
Mhm.
Yeah, absolutely. Well, Alyssa, this was phenomenal. It definitely gave us plenty of information. I'm going to have to rewatch it myself and go back over a
Yeah.
couple of these things, and I will be in touch very soon to get in for my
Yeah.
next
Well, thank you
appointment
for
as well.
having me. This has
Of
been a
course.
pleasure.
Likewise, likewise. So, for those of you watching, if you haven't already, be sure to subscribe, hit that notification bell, like, comment, share, all that good stuff. And I'll put in the show notes all of the contact info for Alyssa so you can follow up with her and get in for your appointments if you're local. And I guess that'll be the last thing I'll throw out there. If somebody's not local, but they do have some questions for you, is there, outside of maybe just them reaching out to ask a few questions, are there any service-based things you can do remotely to help people, be it through the herbalist approach to
Yep.
things and such?
Definitely herbs. Yeah.
Okay.
Obviously, just like you, the physical practice I can't do for someone who's not local, but I
Yep.
have in the past done just herbal consults. And for people who don't want acupuncture and who, even if they're local, who are just interested in herbs, I do that too.
Fantastic. Fantastic. So hopefully we'll send plenty of people your way.
Yeah.
All right. Well, thanks again for watching, everyone. We'll see you next time. And Alyssa, thanks so much. And
Thank
I'll just
you.
ask you, hang on after I hit the end of recording so we can make sure that it all saves for both of us.
Sounds good.